This is a video response presentation for Step 3 Building Capacity Script for Aspen University ADC 605 fall term. The program is designed to be able to establish a alcohol dependence or substance abuse program that's identified in the state of Florida, and prevention programs that are required to be able to help minimize dependence and awareness. So some of the questions that were asked were talked about improve awareness of substance abuse problems and readiness at stakeholders to address these problems. There's not a lot of awareness. A lot of people still look at substance abuse and alcohol still as a, there's a stigma associated to substance abuse and dependence. Mental health, still the full support of resources is still not completely available as compared to somebody going under a heart disease or something similar to that. So that's an area that needs to be worked on, which we have to build capacity for that. Also, we have to establish strengthening the existing partnerships and identifying new opportunities for collaboration. If we're talking about the school system, we're going to be looking at being able to establish relationships and partnerships with the Orange County Sheriff's Office, which is already in place through the MAGIC program here in Florida, where they come in and they present, how to cope with situations such as how to say no, how to cope with problems with substance abuse, alcohol, and general coping skills, gang related and people like that, which are very beneficial because sometimes those are gateways towards substance abuse. In addition, improving organizational resources. Sometimes are limited because in the public school system they're all financially driven by the state. However, you have volunteer programs such as parents, and you also have the counselors that are involved that can also aid into trying to raise awareness for children, youth, and even in the workforce, certain areas to be able to improve prevention programs that are already there. A lot of programs currently contain what's called an EMP, Employee Assistance Programs, which people can use as a resource to be able to evaluate and gain awareness of what they need to do if they have an alcohol or substance abuse problem. Also, we address what needs to be done to develop and prepare prevention workforce. That means what training do they need. The Florida certification has addressed several different areas, which is like cognitive behavior, certified addiction specialist. So if we are adding counselors to the school system, it would be suggested, or I would recommend in terms of building capacity, that some of these counselors have training in substance abuse, have some certification being able to address and identify children that are being exposed, children and adults, even working in the workforce, of these particular problems. So when we talk, the program that I'm trying to establish, it talks about building capacity in alcohol dependence programs in Florida. Building capacity is an important segment of alcohol dependence and prevention programs since it learns how to identify awareness methods, evaluating partnerships, and identifying new opportunities for collaboration while discovering strategies intended to improve organizational resources. There are many steps that can be taken, as I just mentioned. We are using a framework which is called the Strategic Prevention Framework, which is SPF, which is one way that substance abuse can use mental health administration, SAMHSA, to support substance abuse professionals identifying resources. Basically, they're trying to find ways to be able to shape, address, promote, and just raise awareness of substance abuse problems. Also, we have to start doing a better job of addressing pain management. Although pain is a natural way of your body to begin to heal itself, but we have become very complacent with self-medicating. So, pain management is supposed to be something that we can raise awareness of how to handle that. We are starting to take steps towards that, so doctors are being restricted from, it used to be 5, now they're 3-day medications for pain management for controlling drugs and medication. There are also curriculums that are set in place to increase monitoring timeframe procedures that will distance a client from a substance abuse program. Monitoring programs such as once an individual, say a young child or a teenager or somebody goes into a 30-day inpatient program, there's monitoring that goes involved beyond that, where sometimes they'll have safe homes, sometimes they will have programs where they will have added counseling, they'll have group therapy, they will also be required to maintain adherence to step programs or self-help groups, AA, Al-Anon, things like that. So important is to be able to address these type of issues with the public. What is Alcoholics Anonymous? What is Al-Anon? What is NA, Narcotics Anonymous? So that people don't have that stigma that's associated with these type of programs. In addition, we are trying to get strategies established and set in place. For example, we also have in Florida, we have a large influx of Hispanic populations and immigrants that come from different countries in South America. So strategies that can be used to strengthen existing partnerships and identifying new prospects for collaboration must focus on addressing social groups such as diverse Hispanic Latino populations in Florida. And Florida Hispanic Latino populations, as I mentioned, it's growing in size due to the thousands, for example, Cubans, Nicaraguans, Colombians, Venezuelans, overall South Americans. And now with recent hurricanes, we've had a large influx of a Puerto Rican population starting to move into Florida. Therefore, we must do a better job just how we interrelate and how we understand how they view substance abuse and how we present substance abuse and how we address. So multicultural awareness is going to be very important, addressing these types of groups to be able to establish policy addressing alcohol dependence and substance abuse, since the state is continuously reshaping its Hispanic Latino demographic contours. We can try and get partnerships to engage the community to be able to work together to identify, strengthen, and maintain efficient collaborations to aim to prevent substance abuse and misuse outcomes, such as sometimes some of the bad Hispanic populations that are moving into the state of Florida, sometimes since they don't speak the language, sometimes they'll start associating with the negative crowd, so unfortunately they become dependent in order to fit in. So those are some of the issues that we need to discuss and be able to have better control of and raise better awareness. Also, addressing social groups where substance abuse problems are found. Populations vary in nation to the extent of lesbian, gay, bisexual populations, and further independent study is needed. They still have not really put a lot of awareness into the state of Florida, into these type of groups, where I think a big focus should be addressing these types of issues, because those are big coping skills for people that are undergoing these types of life-changing events. For example, the LGBT, lesbian, gay, bisexual, and transgender groups are comfortable while increasing the likelihood of focusing on collaboration, prevention, and treatment programs. In addition, the Florida schools have already started to create programs such as the MAGIC program, which is monitoring, advising, guiding, instructing children, which it's created through the Orange County Sheriff's Office. So they come into the public school systems and they present programs to the children on substance abuse prevention, coping skills, drug awareness, gang awareness, just general programs that are available. And also there is a program that's been established in the high schools, which is called the HOPE program. Also, parent-child relationships, and also the establishing the building capacity footprint. We have to be able to identify once a patient comes out of treatment, we have to have some sort of peer monitoring or some peer support. So students that are in the school system that have gone through programs like that will be great to be able to train them in terms of being able to work and help other young kids that are going through these programs be able to understand what they're going to go through, so that it'll be easier to remain sober, find sobriety, find different programs that will benefit them finding sobriety. And as such, the workforce, we talk about the workforce in Florida, better awareness programs need to be established. Perhaps try and establish relationships with employers to be able to support or carry a little bit more of the cost, so that if a person has a problem, they can say, I have a problem, and understands when that problem has surfaced, so they can get the support to be able to get help. And again, the recommendation would be to build capacity, would be to raise awareness, increase funding to mental health providers, establishing more programs where all the clinicians, psychologists have some sort of certification in the field of substance abuse and alcohol dependence, and also peer monitoring support, which would extend, probably if it extends through the middle school, they would extend into high school, so that they're constantly monitored until they graduate from high school. Those would be great methods for building capacity. And thank you for watching. Have a good night.